The development of severe anxious feelings in the child due to the separation with the primary caregiver is something which is seen quite commonly. But if this separation anxiety is at the level in which it is basically hindering in the life of the child, then it is basically something which is pathological, and one should know how to deal with these separation anxieties as well in the children. Now, there are a lot of reasons that can basically develop these separation anxieties. The primary reason over here is the development of the unsecure attachment with the primary caregiver. If the child has experienced some sort of trauma in his or her life in which basically there was a devastating results due to the separation with the primary caregiver, then he or she is going to develop this kind of a separation anxiety. The features, the clinical presentations are quite similar to any anxiety disorders, ranging from the panic attacks, the phobias, but still the treatment modalities, they are quite different in these kind of separation anxiety, because the patients over here that we're dealing on with are children or the adolescents. So developing this separation anxiety is quite normal, but still if it is of some sort of the pathological kind, one should know how to go about and counsel these patients or give them the therapies that are related to the anxiety disorders and get them out of that particular kind of hindering situation that they're dealing with. So in this section, we'll be first of all defining this separation anxiety. How do you basically diagnose that the child is suffering from such kind of a pathology? Then the etiology of this separation anxiety will be discussed furthermore. And then we'll be discussing the management guidelines that one should follow when we have a child who's suffering from separation anxiety. So defining separation anxiety is basically a specific psychological condition in which the child has excessive anxiety regarding separation from home or from individual to whom the child is attached, the primary caregiver, that is usually the mother. So usually the children experience this separation anxiety with the mother because when we compare these two parents, the mother and the father, usually the children are more attached to the mothers. So the experience is more with the mothers as well. Then it is basically prevalent in all age groups, and it is more common than child separation anxiety. So one should know how to basically deal with these separation anxiety. Usually the children are mostly affected, but still it can be the adults, it can be the adolescents who are affected due to these separation anxieties that we're talking about. The associated features that we usually see or that we usually examine in these children who are suffering from some sort of separation anxieties, the thought content is going to be pessimistic, and then we have the feelings. The overall feelings are going to be of the anxiety disorder. The behaviors are going to be affected. There's going to be an aggressive behavior that is usually identified in these individuals suffering from separation anxiety, feeling that something bad is going to happen. So this pessimistic feeling is going to be there in these individuals. And then we have the refusal to go to school and to go to bed or to go to sleep. So these are the criteria that we're going to see in these individuals. The fear of being alone is also seen in these individuals quite primarily. Bedwetting phenomena is seen again due to the panic attacks and due to the anxiety disorders that these children are going to suffer from. And then we have the physical symptoms, for example, the tachycardia, the sweating. All of these symptoms are obviously due to the adrenergic rush that these children are going to face. So all of these symptoms are going to be seen in these individuals. The excessive worry or the pessimistic thoughts, as we've already dealt in, the nightmares, night terrors, sleepwalking, bedwetting, all of these phenomena are going to be observed in these individuals, in these children who are suffering from the separation anxiety. Then we have a lot of comorbidities that these children can be suffering from. It can be of the physical sort, or it can be of the psychiatric origin as well that these children can be suffering from. We have the ADHD, that is the attention deficit hyperactivity disorder. We have the bipolar affective or the mood disorders, and then we have the panic disorders. That is usually the child is suffering from all of these disorders, and then he has separation anxiety secondarily. So then we can have the anxiety disorders, they basically cover the general social anxiety that the child can suffer from, having difficulty in developing those peer relationships. Those social skills are going to be affected in these individuals. And the panic disorders that are basically characterized by the raised respiratory rate, tachycardia is observed in these individuals, sweating, hand tremors. So all of these panic attack conditions are also going to be seen in these individuals. And symptomatologies are very important when you're diagnosing children who are suffering from separation anxiety. The DSM-IV criteria that basically emphasize that the phobia is a kind of anxiety that is defined in Diagnostic and Statistical Manual of Mental Disorders as irrational fear. So the fear is going to be irrational. No triggering factor is going to be observed in the environment, but still the child is going to have that phobia or that fear. So that irrational fear is basically characterized as phobia when we are dealing with that particular kind of separation anxiety. Fear is defined as emotional or psychological response to the unrecognized threat in the environment. So this is the definition of phobia, and how do we go about defining the fear of an individual. And then we have the etiology of the development of separation anxiety. Any stressful life event, that is basically the post-traumatic stress disorder, can result in the stressful life event, and then the development of the separation anxiety in the children or in the adolescents. The death of a loved one, it can be one of the parents, and the change in the environment of the individual, the sudden subsequent changes can result in these kind of separation anxiety. It can be a stay at the hospital. It can be a traumatizing event that the child had been through in his or her early childhood. So the etiology over here is very important to get over the separation anxiety. The children must feel safe in their home environment. So this is the safety that we can provide to the child to get him out of that separation anxiety that he is feeling, the feeling of being unsecure, even in the presence of the parents or even in the presence of the primary caregivers if he has had. So the trusting people other than their parents should be important, trusting that their parents will return. So this is the thought content that the child will be having. He's going to fear that the parent will not return for him, and he's not going to provide that secured shelter that he or she should provide to the child. So this is the etiology behind the development of the separation anxiety that we're dealing in. The treatment modalities that usually consist of the cognitive behavioral therapy, the psychotherapies, and the parent should seek professional care whenever needed. For older children, the anti-anxiety medications, the changes in the parenting techniques, and the parental counseling. So as the causative factors is coming from the parents, so the parents' counseling is very important over here. Treatment for severe cases, they include the family education, family therapy, and the individual psychotherapy as well. So in this section, basically, we dealt with a very common modality seen in the children known as the separation anxiety. So that is the end of the section. Thank you for watching sqadia.com.